All right, switching gears, this next segment is sponsored by Blue Cross Blue Shield of Illinois. April is National Minority Health Month, and today on our health segment, we're here with Dr. Derek Robinson, Vice President and Chief Medical Officer at Blue Cross Blue Shield of Illinois. He's here to talk about many things surrounding this month. So, Dr. Robinson, thank you so much for joining us today.
Lamaya, thank you for allowing me to be with you all again.
Yeah, so let's talk about health disparities in general. Tell me a little bit about those.
Sure. So again, as you noted, this is Minority Health Month across the United States. It's a great opportunity for us to elevate our focus on improving health in racial and ethnic minoritized communities, or those communities that have been socially disadvantaged historically. And we're typically talking about the African American, Hispanic, American Indian, and Asian communities and others. We know through both our history as well as data from the CDC that these communities bear a disproportionate burden of chronic medical conditions like diabetes, asthma, high blood pressure, cardiovascular disease, and stroke. Also a disproportionate burden of injury as well as shorter life expectancies. And so this is a great time for us, again, to renew our focus on how we can collectively improve the health of not only our minoritized communities, but all communities across the United States.
So if health disparities are preventable differences in diseases experienced by racial and ethnic minoritized groups or socially disadvantaged populations, how does it differ from health inequities?
Those are great questions. And a way I would try to simplify it is health disparities really represent differences. So think about differences in the incidence of breast cancer between men and women. We know that both men and women have breasts, but women have more breast tissue and different hormones. And so we see a higher incidence of breast cancer in women than men. That is a health disparity, but it's not an unfair health disparity. When we talk about health inequities, we're talking about unfair differences. So when we look at the difference in the death rate from breast cancer between African American women and white women, for example. So when we think about the social risk, which relate to environmental risk, diet, access to screening, access to treatment, and quality of care, these are things that contribute to the differences that we see in the death rate between Black women and white women with breast cancer, and that is a health inequity. So really, when we begin to talk about this space, we're also talking about the social determinants of health, where people live, their zip code, their access to employment, education, healthy foods, and safety. So these are things that impact 80% of what comprises our health. And the social determinants of health are influenced by the political determinants of health. So policies at this local, state, and federal level, actions of government and voting. So when we think about how to address some of the health inequities, we have to address both the social determinants of health and the political determinants of health.
Yeah, and so let's talk about what we can do, Dr. Robinson. How can we help counter health inequities and address health disparities?
Well, one of the things I think is really important for us, especially in today's climate, is to really be supportive of inclusion and supportive of fairness. And so let's look at opportunities where we can engage with organizations that are working to help ensure that everyone in our community has access to not only great health care, but many of the social determinants that influence their overall health. And so it encourages people to get involved with local nonprofits that are supporting healthy activities for young people, supporting access to healthy food, ensuring that the housing and housing environment and lived experiences of individuals are positive and fair. Those are some of the ways that we can get involved. And certainly also being civically active, voting, and being engaged in policy issues at the local level are important as well.
Yeah, very good information here, Dr. Derek Robinson. Thank you so much, and we'll see you next time.
Thanks for watching. Stick around by subscribing today and don't miss a single video.